They decided that they would pick a fight on health care. Well, let me look right into the camera and tell you very clearly, Republicans are the ones concerned about health care. Republicans are the party working around the clock every day to fix health care.
In Speaker Mike Johnson's Louisiana district, a 60-year-old couple earning $82,000 a year, their health care premiums will rise by almost $20,000, by 300%.
Now, that is specifically in Mike Johnson's district. I'm sure he's familiar with that rise in costs because he's the one that truly cares about healthcare, he postures. But the issue is that it isn't just for Mike Johnson's district that prices are going to go up, and many people could face economic catastrophe. More than 20 million Americans, significant percentage of the American public, are expected to see their health insurance premiums more than double next year unless the Democrats are successful in extending these ACA subsidies. If Mike Johnson gets his way, they will not be extended, not for a year, not for a day, they will be done. And these price increases will be locked in. That will simply be the way it goes forward. And so I don't know how you make the case that you're the one that cares about health insurance when the law that the subsidy applies to never would have been passed if you were in charge. You've never presented an alternative healthcare plan, and you're trying to make sure that those subsidies don't get extended. If you want to cosplay as caring about healthcare, you could have insisted that the subsidies be continued in exchange for keeping the government open, but you didn't do that, okay? And so let's talk about some of the areas where we already know what the price increases are gonna be like, because there's a number of states where you can go on health insurance marketplaces in places like California, Maine, Minnesota, Vermont, Oregon and Kentucky, and you can do sort of like preemptive window shopping for what your health insurance premiums are gonna be like next year once the subsidies are gone. And so we're gonna jump into, like they did in that first clip we played, and show you some of the changes that people can expect. So for a hypothetical 60-year-old couple making $85,000 a year in Clay County, Kentucky, one clear silver plan that currently charges a premium of $559 per month, which is already a lot of money, could more than, what is that, quadrupling to $2,736 a month. That's more than rent should cost. That's a mortgage. That's just for your health insurance. Here in California, premiums for the same couple's Anthem Blue Cross Silver plan would more than quadruple from over $500 per month to over $2,100 next year. In Medford, Oregon, a Moda Health Silver plan would increase from $622 to $2,644. The same case in Vermont. Basically, all of these plans that they're finding are at least quadrupling, and they were not cheap to begin with. And there are some cases where there are now quite affordable plans that also are seeing massive rises. So in Tennessee, there's more than 500,000 people just in Tennessee that pay lower premiums due to the subsidies. Sherry Roberts of Chattanooga said that if the current subsidies are allowed to expire, her current $10 a month premium will go up to $1,140. And I don't know how you deal with that as a regular. I mean, that's absolutely insane. She doesn't seem to know. She says she might die if she stops going to the doctor, and she might well have to stop going to the doctor because she'll lose her home if she has to pay that much. And all of this, which is facing 20 million Americans, Mike Johnson says, the Democrats, they're just posturing. Oh, they're trying to pick a fight on health care. Okay, but it's not just politics. It's an economic disaster looming on the horizon for millions of people, including, by the way, a majority of whom are likely to be Republicans, or at the very least, live in districts that are currently governed by Republicans. 57% live in congressional districts represented by Republicans. So you would think that they could at least pretend to care about their people being screwed over by their actions. But what do you think?
Isn't this exciting though? Isn't this exciting? It's like the people's lives on a daily basis are so boring and low stakes. Now, imagine this. We're all like, price of eggs are going up $1. Now your healthcare is going up thousands of dollars every month. How are you gonna handle that? That's like when Neo gets shot and he has to go like this in the Matrix. You have to dodge these like very fast moving, horribly dangerous things flying at you. Isn't it neat? Thanks, Republicans. Like this guy's
spicing things up.
Oh, it's so awesome. This guy's saying he wants to fix the healthcare system. He wants to fix the healthcare system the way Arnold Rothstein fixed the World Series in 1919. He's fixing it for the wrong people, not you and me. I can prove that. He's eliminating subsidies for people on healthcare. That's not a solution. That is a problem for people.
Yeah.
But then if all this money, now the money is gonna go to the insurance providers, but it won't be subsidies based on tax collection, which in a progressive tax system theoretically taxes the rich more than it taxes the poor. Now they're just shifting more and more of the burden onto poor people. And that is the Republican economic model, actually. It's not to do things like, Zoran wants to do, progressive folks want to do. It's basically unleashing. Like, this is one of the reasons that Marjorie Taylor Greene is mad at Donald Trump right now. This administration and Mike Johnson specifically, whom she called out by name, like they only want to create systems that allow the rich to benefit off of the poor. A lot more than they are now, and the proof that the rich are winning already without these changes that the Trump administration is making is because the rich are rich and the poor are already poor.
Yeah, that's a good clue.
That's a clue, yeah.
Exactly. Yeah, and this, like a lot of this just is not sustainable. You cannot go from paying $500 to $2,600. Like that just. Society will fall. It's like we were saying yesterday, capitalism is great until you run out of other people's money, out of the poor's money. And that's right. It's just not gonna work.
But it's not that they're gonna run out of money. They might just not pay their insurance premiums, you see. And then it's not that they're not gonna run out of money. They'll save that money, save all the money they were paying before, plus some. They're just gonna die.
Yeah, die or have to go to emergency rooms for things that should have been caught much earlier.
Which we end up paying more for.
More inefficient. If you enjoyed that, then make sure that you never miss another video by subscribing. And if you want a little more, consider hitting the join button and becoming a member. So you're probably wondering, why would I do that? Well, when you do that, you get access to bonus content that I make every single week, and it's a lot of fun. You get custom emojis and more. If you join at tier 3, by the way, you even get access to a monthly member hangout with myself. And you'll get all that going forward, but you'll also unlock years of the back catalog. That is literally 100 or more bonus clips and top 10 lists and debates and more. So what are you waiting for?